Hello. I'm your host, Pressure Injury Bob. The Patient University presents Patient Safety Short Series. Pain Medication in a Hospital. Important: do not wait to report an increase of pain or any other associated symptoms. Did you know, pain medication in a hospital, that is ordered, PRN, also known as needed, means pain medications are not automatically administered. This is a common area of confusion. This means the patient will need to request their pain medication, as it is needed. Chain of communication. Figuring out who to report pain medication request to. Because the nurse is the most common person administering pain medication, it is ideal to report pain directly to the patient's nurse. The challenge: due to the current nature of hospitals, it can be difficult to get a nurse to come into the patient's room when requested. This results in patients and families having medical-related conversations with people who are not their nurse. Patients and families report pain medication requests to almost anyone that enters the room. This does not ensure that the nurse was notified of the pain medication request. This can result in a communication breakdown and delay of care. The person reported to may not see or locate the nurse. They may even forget. This results in a loss of communication. Tip alert: nurses enter patients' rooms to administer regularly scheduled medications and do assessments. This is a great time to discuss the pain plan with the nurse. The pain scale. Getting to know the pain scale is important. The pain level number can indicate level of pain, mild, moderate, or severe. Can be used to measure effectiveness of pain medication. In addition, help determine pain medication appropriate for that level of pain. When reporting a pain level number, remember to include one of the following: mild, moderate, severe, or the worst I've ever had. This is because everyone's pain description is different. Tip alert: hospital pain medication math. Generally, hospital staff work 12-hour shifts. Take 2 hours off for shift change. This leaves 10 hours. Use this information to figure out if the same nurse will be available to give the next pain medication dose. Pain plan. What is it? It is a discussion with the doctor about the pain medications they have ordered. And it is a discussion with the nurse regarding the particulars: who, what, when and how pain medications will be administered. Pain plan supply list. Cheat sheet with pain medication questions. Paper and pen. Clock. Flip-top stenographer's notebook is very handy for taking notes. Download your copy of Hospital Pain Medication Cheat Sheet, or request by email, at the Patient University website. Remember, don't forget your phone charger. Formulating the pain plan. Determine the baseline level of pain. This will help anticipate what medications will most likely be needed. Pain medication choice is partially based on the patient's level of pain, or pain level number. Discussion with the nurse. My pain level is. Provide the pain level number and description. What different kinds of pain medication are ordered for me? Will you help me to remember to write down? the time I had my pain medication, and when I can request it again if I need it. Discussion with the nurse continued. What happens if the pain medication isn't working? What is the best way of getting a hold of you? How far in advance should I request my pain medication? Discussion with the nurse continues. How often and when is my next dose of pain medication? What will happen at shift change? Will I be able to get my pain medication? What happens if I fall asleep? Will you still give me my pain medication? Will I need a laxative or a stool softener? My last bowel movement was, provide the date. Each time pain medication is given, write down the time given, and the time of the next available dose. Note the pain level number. Have nurse assist with writing this down. Determine if this is the same nurse that will give the next dose. Discussion with nurse continued. Change of shift. You will need to discuss your pain plan with new shift nurse. Pain medications requested on a previous shift will not necessarily be administered automatically. That is because the new shift nurse will probably do an assessment prior to administering the pain medication. Pain plan with nurse. Please read this quick review list. Remember, ask the nurse who will be giving next pain medication dose. Do not rely on the next shift knowing when you want your pain medication. New shift nurse means new pain plan discussion. The WHO. Formulating a pain plan with your nurse will go a long way in helping you achieve the pain relief you need. The goal of adequate pain relief. Achieving adequate pain relief may require ongoing discussions with your doctor and nurses. Some patients may even require a scheduled pain medication regimen. Please discuss your pain medication plan with your doctor and nurses. Remember your pain plan. It is your tool for achieving effective pain relief. Please visit the Patient University website to download or request by email the hospital pain medication cheat sheet. You can view this video on the Patient University website, our YouTube channel, and our Facebook page. We would love to have you join our Facebook group. The email address is thepatientuniversity@gmail.com. Thank you for participating in this patient safety video.